Hi, my name is Cindy, and like many of you, I receive services at St. Clair County Mental Health. COVID-19 has changed how we do things, from how we work, what we do in our spare time, and who we can see face to face. It's not a surprise that it has also changed how you and I will receive services at community mental health until the virus is under control. These changes are to ensure our health and the safety and the health and safety of our friends and family and the community mental health staff. Some of these changes may take some time to get used to. Some may even seem to make you a little nervous. It's perfectly natural if you feel that way. But remember, these measures are in place precisely to ensure that there is no reason for you or me to be concerned about coming to CMH. First, if you are able to, please come alone to your appointment. If you need someone to give you a ride, if possible, it is preferable for them to remain in their car or outside the building. This will make social distancing in the building easier. Of course, CMH is also asking everyone to wear a mask. Everyone entering the building must do so from the front entrance to ensure there are not too many people in the building at one time. CMH is asking that we arrive no sooner than 15 minutes before our scheduled appointment. While waiting to enter the building through the front doors, you'll notice spots marked to indicate where you can stand to maintain proper social distancing. People will be allowed in the building one at a time, so there aren't more than 2 people in the vestibule at a time, where proper social distancing cannot be maintained. For everyone's protection, CMH nursing staff will be in the vestibule to take your temperature with a forehead or an ear thermometer. They are doing this because a high temperature may mean a person is ill. If you are running a high temperature, your appointment might have to be rescheduled.
Hi, are you here for an appointment today?
Yes, I am.
Well, you've got a great mask on right now. So what I'm going to do is I'm going to check your temperature, and I use a forehead thermometer. Don't even have to touch it.
Okay, thank you.
Okay. Oh, very good. It's 97.3, so that's normal. I have a few questions I have to ask. To your knowledge, have you been exposed to anybody that was positive for coronavirus?
No, I haven't.
Have you done any traveling at all?
Not at all.
Have you had a fever or not felt well, short of breath?
No, not at all.
Fantastic.
Okay.
What I'm going to do is I'm going to let you go through. There's a hand sanitizer station right here if you'd like to use it. You can go right up to the line there and they'll take care of your front desk.
Okay,
Thanks for being so patient.
Oh, no problem. Thank you.
Bye-bye.
The first thing we need to do when we enter the building is use the hand sanitizer just inside the front door. Once you are inside the building, please go to the front desk. Notice how I am waiting in line and maintaining a safe 6 feet distance from the person in line ahead of me. If all staff are busy with someone, do not stand directly behind the individuals they are helping. As you walk up, you will notice clear plastic barriers in place at the front desk. This is just a precaution. You will also notice tape on the floor that shows where you should stand in order to maintain safe social distancing from staff. In order to help you maintain safe social distancing, CMH is staggering appointments and controlling the number of people in the building at any given time. However, they need us to help too. When in the building, we need to make every effort to practice safe social distancing from everyone else. That means making every effort to stand or sit 6 feet apart from everyone else. While you are waiting, you will see CMH staff regularly disinfecting and cleaning surfaces. CMH is following the strict cleaning guidelines to guarantee the building remains free of COVID-19. However, we can help here too. Try not to touch surfaces unnecessarily. Remember, it is possible to have COVID-19 for several weeks before showing symptoms, and most people who contract the virus never show symptoms at all. So it is possible to have the virus, not get sick, but pass it on to others. Then before you know it, it's time for your appointment.
So now that we're finally back together again, we can start doing our good work together. How do you feel about that? How do you feel about being in the building and wearing a mask and being out in public again?
Well, I'm really glad that you guys are here for us. You know, it's much needed. It's been really hard not being around people and being able to have face-to-face therapy. And I really appreciate the fact that you guys are willing to see us like this. One final precaution, it is always good practice after you've been in any public place to take time to wash your hands thoroughly with soap and hot water for 20 seconds. By all of us following a few common sense safety measures, CMH can continue to provide us the best care possible. Remember, we are all in this together.